Dr. Vicki Dashley again from TLC Animal Hospital, joined by Papaya, our little Kaik parrot. She's been whistling quite a bit, so we'll see. She might provide our soundtrack for this segment as well. So our last talk is going to be about how to monitor our birds for any signs of potential illness that could indicate a need to go see the vet. I do recommend regular physical exams so that we can try to catch any problems early. Otherwise, we do want to keep an eye on them at home. Birds are a prey species, which means that they're well adapted to mask signs of illness because they don't want to look weak and potentially be picked off by a predator. So oftentimes by the time they look sick, it's something that's severe. This is serious, yes. It's oftentimes severe and might have been going on for quite a bit longer than we think. So we want to be able to get clued into even small changes in our bird's appearance or behavior or appetite that can indicate that they're struggling. So some signs of illness that we want to be watchful for, any change in behavior. So if you kind of know what your bird's routine is and how they generally act, if they start to deviate from that, that could be a potential sign that something's not right. So for example, if you have a bird who's very vocal, like Papaya here, if she was suddenly less vocal, that could indicate that she's not feeling well. They might eat a little bit less or not be eating at all, which isn't always obvious by looking at the food bowl, but we do want to check the food bowl, especially if we're changing the cage out daily. Then we should be able to see how much stool is being produced every day, if the quantity of stool is dramatically declining, if the stool is black or a very dark green, when it's still moist. Those are potential indicators that they're not eating enough. If the bird is losing weight, and you can tell that either by feeling on their chest, the breastbone, a healthy body weight, the musculature should come off the breastbone in a triangle. Chubby birds, it might be a circle, or if they're chicken breasted, they're really overweight, but it should definitely not be concave. Concave means that they're losing muscle and they're in a negative energy balance state. Another good thing to do, we talked before about training behaviors that can be useful. One useful behavior is training them to perch on a scale. And you can use a gram scale or a food scale, and oftentimes you can either have them stand on it flat, or you can get little modified perches that you can use. So getting a weight on them every week and tracking that, and if you're seeing dramatic changes in weight or a steady decline in weight, then that's could indicate a potential problem. The classic sick bird, this is usually going to be when they're more seriously ill, is a bird who is fluffed up and looks sleepy. Their eyes are closing. They look like they're on the edge of falling asleep, but it's not at bedtime. This behavior would be inappropriate during the day when they're usually active. Very inappropriate when they come into the doctor's office. They should be hyper alert, not looking like they're about to nod off. Oftentimes these birds will also be down at the bottom of their cage for prolonged periods, so that's a big red flag that they're quite ill and need to be seen as soon as possible. So those are just some of the things to watch for. Certainly, if you notice anything that's out of the ordinary or that you're concerned about, don't hesitate to reach out to your vet or take your bird in for a checkup just to be on the safe side. Hope you guys have a great day. Thank you so much.